my name is Collin Doughty, and this is my final project for current issues in healthcare. The healthcare problem that I have decided to discuss for my final project is short staffing in healthcare organizations. There are many negative effects that this problem has had on both the healthcare facilities and the local businesses that we see in our world today. I am going to be discussing the causes, the effects, and some solutions that might get us back to full staffing in our organizations. As everyone knows, our world took a turn for the worst whenever the COVID-19 pandemic came to the United States. Our world was in distress, and everyone was trying to figure out what the best approach was to get through this disease. This consisted of a worldwide shutdown that only left essential operations running. Some examples of this would be medical personnel, grocery store workers, police, fire, and EMS workers. The effects of this have left many people without jobs and caused our government to provide stimulus checks to the people who needed extra financial help during this time. The effects of the stimulus checks were good during the time of need, but now we have noticed that many people have lost the work ethic to return to work and are still relying on the government to take care of them. People felt overworked during COVID, and many people said that they were emotionally exhausted from watching people die. Another major group that we lost during the pandemic is the elderly population that was working in our facilities. These people were nearing their retirement, but due to the scare the pandemic caused, these people took an early retirement so that they could avoid working in these conditions. Another major factor that plays a role in the hospitals being short-staffed is people not wanting to work in stressful environments. Some departments in the hospital have to deal with traumas and are put in fast-paced situations that require quick decision-making. Some examples of this would be doctors and PAs, cath lab workers, and surgeons. Some people just are not cut out for these departments, so this causes a shortage in employee availability. The final factor that causes the hospital to be short-staffed is employees being overworked. Since there are a lack of employees within the healthcare system, the people who have stuck it out are required to do more work. This causes people to become emotionally and physically drained, which makes them seek work elsewhere. When I worked at Marietta Memorial, being overworked was a major negative factor for the employees in the cardiovascular ultrasound department. Since we only had 4 techs there a day to scan over 60 patients, we were required to stay late and get all the patients scanned. This would sometimes mean staying till 8 or 9 o'clock and working 12 to 13 hour days, which can definitely burn someone out. I will now be talking about some of the effects that being short-staffed has had on a healthcare organization. The first problem that can arise is being unstaffed can increase risk of mistakes. This can cause the staff to become tired and rushed due to the long hours. This increases the risk of medical errors, and the potential for patient harm increases. Employees who are well rested and ready to provide the best care will result in better patient outcomes. A statistic from the Nurse Grid stated that nurse burnout is near an epidemic, and an estimated 17.5% of newly licensed RNs leave their first nursing job within a year, and 1 in 3 leave within 2 years. A shortage in employees also increases the risk of patient falls. Since you are spending less time with each patient, the patient themselves might attempt to do more if they are not properly cared for. In my line of work, scanning heart ultrasounds, if a cardiovascular department is short staffed, you might notice that techs start to rush through the exams. When you are rushing through an exam, there is a strong possibility that you could miss something on their echocardiogram. There are many conditions that can arise from heart problems, and if you miss them, patients can be put in major life-threatening harm. The second problem that arises from facilities being short-staffed is patient satisfaction decreases. In the healthcare field, it is our responsibility as healthcare personnel to provide patients with the safest and most efficient care possible. If you are not able to schedule appointments for patients in a timely manner or you are rushing through their care, they can become dissatisfied with your organization. Patients want you to be invested in their care, which means putting time and effort into making sure they know their care is important to you. Simply taking the time to get to know them and what their issues are can make a huge difference in patient satisfaction. Being understaffed sometimes has a negative impact on the amount of time that you are able to spend with the patients you are caring for. A lot of facilities also provide outpatient services and testing for patients. When you have a shortage of doctors or personnel to do testing, it can take longer to get results back from their test. This can also potentially put the patient in danger because something could be found on the test that gets overlooked. The third problem that can arise from facilities being understaffed is employee satisfaction going down. When a facility is short staffed, it can be emotionally draining on the people working within the department. This can result in team dynamics being strained. Since tension is high from being short staffed, it can have a negative impact on the relationships that you have with your coworkers. Some examples of things you can see are arguments, yelling, verbal abuse, and even sometimes physical abuse. This negative working environment can cause current employees to leave and also potential new hires not to want to be part of your team. The goal of a healthcare organization is to build a strong team that will provide adequate patient care to everyone who enters the facility. Negative workplace environments are one of the leading causes of people being dissatisfied with their jobs. The final problem that can also arise from being short-staffed is it can cost the organization more to hire employees. Since the COVID-19 pandemic, we have seen a major rise in the amount of traveling nurses and other medical personnel. Since the facilities are not able to keep full-time employees working in the area, they are being forced to seek help elsewhere. People are coming from all around the world to help bear the burden of being short-staffed. Hiring these travelers are way more expensive than hiring full-time employees in your community. Travelers are assigned short-term contracts that are making double what the full-time employees at the organization are making. This is causing many organizations around the country to struggle financially to make ends meet. Due to financial struggles, facilities are having to sacrifice new equipment, department upgrades, and sometimes even raises for the regular full-time employees. Finally, I will be talking about some of the solutions that managers can implement in their facilities to solve the problem of short staffing. The first solution that a manager can do to help deal with short staffing is prioritizing assignments. The concept of prioritizing assignments can deal with many aspects of how a department is run. This means establishing clear, organized roles that are reasonable for each employee to complete throughout the day. Having an unorganized approach to the day can cause more chaos to arise from being short-staffed. A manager can also step in and assist the employees whenever they are having an overwhelmed day. From a nursing standpoint, this might mean the nursing supervisor stepping in and completing little things for the other nurses so that they are not rushing around and mistakes aren't being made. Prioritizing assignments also means that you try at all costs to make sure that your employees aren't being overworked and they have to stay over every day. This will help avoid the emotional burnout that sometimes occurs from being short-staffed. The second solution that a manager can do to help with short staffing is communicate effectively and nicely. As I've talked about in previous slides, employees can sometimes feel emotionally abused when working in stressful, short-staffed environments. These employees are already having to work harder to help account for the burden of not having enough personnel to care for patients, so it is important that the manager of the department shows how much they appreciate their employees and what they do. This means having clear methods of communication and making sure they relay information in a professional and caring way. Having managers who create a positive working environment helps keep employees wanting to stay in the organization even during the stressful times of being short-staffed. The final solution that a manager can do to help with short staffing is recruit people for the department. We live in a world today that has so many resources to assist with communications, such as text messages, emails, flyers, web pages, and many more. Managers can use these methods of communication to help find people to come work for the department. These resources are available to both members of the community at your facility and outside of the community. These messages should include reasons why your organization is a positive environment, along with your goal and what you wish to accomplish. Some organizations will also provide sign-on bonuses to people who are willing to sign a contract for a couple years, which can help people come to your facility. Using these methods of recruiting can help managers solve the problem of short staffing and gain a great team that will impact the community in a positive way. I thank you for listening to my presentation, and I appreciate all the insight that you have given me throughout this 6-week course. Thank you, and I hope you have a great day.